All right, guys, we have a great show today on today's Poop Tip Tuesday. We're going to talk about all about gastric bypass. Is it the right thing for you? What exactly is gastric bypass? Who are the best candidates? And the pros and the cons with this surgery. And in today's video, go over any live questions you guys may have as well. Guys, don't forget, let's talk about poop. Hey guys, my name is Dr. Samir Islam. My passion is to give you tips and tricks to help out with your gut health. I grew up in a small town called Odessa, Texas. You may have known that from the movie Friday Night Lights or even the TV show. I did my undergrad at the University of Texas at Austin, go Longhorns, and I did my GI fellowship training at the Mayo Clinic. So guys, let's talk about poop. All right, we have a great show today. I want to thank you for joining me today on my social media live stream. If you haven't joined me before, my name is Dr. Islam, and yes, I am an actual poop doctor. That is my passion, is to give you, yes you, the best tips and tricks to help out with your gut so you can live your best life. Every other Tuesday, go live on the social media streams to answer your questions you guys may have and to do a deep dive on one topic that I can hopefully give you guys the best information on. If you haven't already, don't forget to smash that like button, like, share, and subscribe. And if you haven't already, tell your friends all about this live video I do every other Tuesday. If you want to get notified about these videos, don't forget to subscribe to my newsletter and also like and share and follow my pages as well. And if you have a live question for me, go ahead and put it on the chat. I'll get to those live questions at the very end. Let me know in the comments if you're watching this live or on the replay. And also let me know where you're watching this as well. I love to see where my audience is watching these videos as well. Hope you guys are doing great. Hope you guys have a great Tuesday and a great weekend coming up. I am excited about this weekend because this weekend is Texas OU. Oh yes, my Longhorns. We are doing pretty good after that loss to Arkansas, and I cannot wait to watch the football game this weekend. Let me know in the comments if you're excited just like me about football or even UT football as well. Vidya, it's good seeing you. I'll answer your questions. Angela, it's good seeing you as well. B, it's good seeing you. And Gracie, thank you for watching on the live stream as well. Thank you guys so much. And we are going to go ahead and answer. We'll go into today's topic, which is gastric bypass. Oh my goodness, does it actually work? Let me know in the comments. Have you been thinking about gastric bypass? Have you been thinking about getting this type of surgery for weight loss? Is this something you are considering, or do you know somebody who's had gastric surgery and what was their experience as well? I would love to hear in your comments on that. Yukia, thank you for watching on the live stream from Anaheim. Thank you so much. So, question number one, hey, Dr. Islam, what exactly is gastric bypass? Well, it's a very good question. And this is a surgical procedure, mostly surgery, because there's a little tidbit for that as well, in which you actually bypass part of your GI tract to help you lose the weight that you want to lose. And there are a couple of different bypasses that are out there. Sometimes you can do what's called a Roux-en-Y, which you reroute your whole entire small intestine and to connect things there. Sometimes you can actually cut off part of your stomach as well. And there are other different deviations of this particular surgery. But the whole goal is to do one of two things. One is that you either restrict the amount of food that you can eat, and or you also cause malabsorption as well. So whatever you do eat, you just really get rid of it. And there are risks and benefits of this as well, which we'll talk about later on in this video. But this is basically what gastric bypass is you're just rerouting part of your GI tract, either cutting part of it or moving pieces around to allow you to not eat as much, or if you do eat, it goes through very quickly and you actually can have absorption problems with that as well. And it does seem to work. So question number two, who are the best candidates for gastric bypass? Because not everyone should get a bypass and not everyone will qualify for a bypass as well. So bypass has been around for a long time. And we actually have some guidelines that allow us to determine which individual is the best person to get a gastric bypass. So we know if your body mass index or BMI is greater than 40, that typically will qualify you to get gastric bypass, and that typical qualification will allow you to get that covered by your insurance. But also, if you have a body mass index or a BMI greater than 35, plus an obesity-related complication with that, so for example, high blood pressure, diabetes, maybe sleep apnea, maybe heart issues, that also may qualify you based on insurance to get qualified for a gastric bypass. These are the typical medical indications for a gastric bypass. However, there may be other things that you need to do to qualify as well, because there are some things that would tell a surgeon or a doctor, hey, you may not be the best candidate for this. So for example, if you have maybe severe heart problems, it may be more difficult for you to undergo that type of surgery. Or maybe you don't have the social support that you need at home to allow you to lose the weight that you want to lose. Sometimes you may have a lot of stressors in your life that may be very difficult for you to do the job that you need to do. So it involves a team of professionals, including surgeons, doctors, maybe even psychiatrists or psychologists, to make sure we do the right thing for each individual patient, because there is no point in someone undergoing a surgery and then coming to realize, hey, you are not the best candidate for this, or you may have had a condition which should preclude you from having this type of surgery. But in essence, it is a BMI greater than 40 or a BMI greater than 35, which has other obesity-related complications that will get you in the doorway of proceeding with a gastric bypass. All right. Perfect. And what good? Abdul, good. Yes, your colleague had a gastric bypass and she's very happy with the results. A lot of people are as well. And Angela, absolutely, you're right. And yes, a lot of people go to Mexico for this as well. We'll talk about that as well. All right, perfect. So, question number 3. Hey, Dr. Islam, what are the pros and the cons of gastric bypass? So the pros, number 1, it works. Absolutely, it works. We have very good research and information from quite some time, actually, that does show that gastric bypass does work. And you can lose up to at least 100 pounds, maybe 150, 200, depending on the type of bypass and what your goals are as well. Number 2 pro is that the risk of obesity, all those medical problems, typically go away. So high blood pressure goes away. You can get off your medications. Diabetes typically go away. Get off your medications. Heart disease may improve. Get off your medications. Liver disease actually may improve and reverse. You can get off your medications for that as well. So the complications, the medical complications from obesity tend to go away. Number 3 is that your quality of life will get better. Absolutely, it does. You can move, you can exercise, you can do the things that you could not do before, and this brings on a very incredible cycle of more weight loss, feeling better, losing more weight, more exercise, and it ends up being a reinforcing effect, and it does work for those individuals. However, there are some cons. Number 1 is that it's surgery. And surgery in and of itself has risk and benefits, because even in the best of hands, surgery sometimes do go wrong. Absolutely it does. And it's not anyone's fault. It's just the way it happens. And so there is a risk with going under the knife. Number 2 is that for a lot of our patients who undergo gastric bypass, they actually do have some significant problems that can occur with depression or anxiety. It is a dramatic change from what you were before to what you are after surgery in terms of how you look and how you may see yourself. And for some individuals, that change can bring on depression and anxiety as well. And there's a very documented evidence that sometimes surgery can be very stressful on the mind for those individuals. Number 3 is that you can have other medical problems with this. Commonly, I see patients who have acid reflux, bad acid reflux, after a gastric bypass, which can be very difficult for us to control without medications or other surgeries because of the severity of the acid that they're having. And then lastly, very important, just because you have surgery doesn't necessarily guarantee you're going to lose the weight or maintain that weight loss. There are plenty of patients who have surgery who still gain the weight back. Absolutely. So the gastric bypass acts as kind of like a bumper car, where it kind of gives you the lane to go down. But people very calmly go off that lane and they go down their own path. And if they do that, they still may get the weight back than what they lost before. So let me know in the comments below, have you noticed anybody else have any pros or cons, or would you add anything to this list as well? But for the right individual, gastric bypass and gastric surgery works, it's effective, and it helps you to lose the weight and maintain that weight loss as well. All right. Thank you guys for watching. Let's go and answer some more questions here. So we have a good question here. There are a lot of people who go to Mexico for gastric weight loss. Came home 2 days later. How can that be safe? It's a very good question. So I'll tell you, there are excellent places around the world that specialize in weight loss surgery, whether it's in Mexico, South America, Europe, extremely reputable areas. But just like in the United States, there are areas that may not be as reputable or may not be that good. That's also in the US, but also outside the US as well. My advice is to do your research. Look at the center. Make sure it's a center of excellence for gastric bypass, because we have this designation currently here in the United States and other areas as well. Find out what the results were. If you know somebody who went there, obviously get their expectation as well. Gastric bypass is a pretty standard procedure done in the right hands, but like anyone else, if you don't have the right hands, if you don't have the right environment, it can end up being a disaster. I've had patients go both ways. Excellent results doing this abroad, and terrible results doing this abroad as well. But also that same thing can happen if you do it here in the United States. Great question. All right. So Francisco, good question. If I eat something greasy and acidic, I generally feel okay after the meal, but it's not until the next day that I feel warm and burning sensation in my lower abdomen below the belly button. Why is that? It's a very good question, and this is a very hard question to ask in particular for you, but I can tell you that may be because that is what is going on when your GI tract moves along the colon. And so if you feel around your belly button is where your colon is at, and typically for a lot of my patients who have pain in that area, that may be colon pain, and that's a very common reason for us to have pain around the belly button. Obviously, if there's other organs going on there too. You have your bladder, which can be around the area, and if you're a female, you can have some of your female parts that are there as well. But sometimes that burning sensation can be a issue going on inside the colon. There may be further investigation to find out exactly if that's the case or what else needs to be done for that. All right. Perfect. Another good question. Have I seen the TikTok video about mixing coffee grounds, water, and lemon, and it will clean your system and reduce belly fat? Any truth? Pretty easy answer to this. No truth whatsoever. Absolutely, there's not. And so if you see these kind of quick tip videos on social media about how to lose belly weight or belly fat by mixing things like this, I can tell you 100% it does not work. What you will lose is water weight, which will make you feel like you are losing belly fat. But it doesn't actually do that. There's no evidence for that. There's no physiological way that can happen. And there's absolutely no way there's any truth to that as well. I am glad you helped me to debunk this particular myth. And there's no truth whatsoever with that as well. All right, guys. Perfect. All right. Well, I think most of the questions have been answered. I want to thank you guys for watching today. Don't forget to like, share, subscribe to my social media channel. If you have a question that you want me to answer as well, send me a message. And also, don't forget to tune in 2 weeks when we have a couple of different topics. If you want to get notified of these topics, don't forget to subscribe to my weekly newsletter, subscribe to my channel, and to subscribe to any of these social media channels as well. Hope you have a happy and healthy day. And guys, don't forget, let's talk about poop. See you guys in 2 weeks, okay? Thanks, everybody. Take care.